You are to blame for the lack of healthy, fresh foods in low-income neighborhoods. The government is responsible for the people who have to live the rest of their lives trying to stray away from being oppressed because they are obese due to their disadvantage to access healthy food. Low-income areas have half as many healthy stores as the wealthiest ones, and 4 times as many small corner stores. Imagine living in a low-income neighborhood, being overweight, and wanting to change your life. It is like trying to find a needle in a haystack. It is almost impossible.
Over the past 30 years, the number of overweight children has doubled and the number of overweight teenagers has tripled. Diabetes prevalence increased by 33% in the past 10 years. Over 300,000 deaths per year are caused by poor nutrition. 1 out of 3 children born today will develop diabetes at some point in their lifetime if current diet trends continue. Of course, the government, being an outgroup, will view those living in the low-income communities as being irresponsible and careless because they aren't trying to take steps to help improve their situations. On the flip side, it is the government's responsibility to watch over the prosperity of the citizens.
Unhealthy eating not only hurts individuals but also hurts the economy. The lack of access to healthy foods can have adverse effects on an individual's health. A diet poor in fruits and vegetables increases the risk of diabetes, heart disease, cancer, and other illnesses that disproportionately affect people of color. Due to primarily unhealthy eating, more than 109 million Americans report having at least one of 7 chronic diseases, for a total of 162 million cases annually. The total impact of these diseases on the economy is $1.3 trillion annually. Statistics show that on our current path, by 2023, researchers project a 42% increase in the cases of the 7 chronic diseases. Poor dietary behaviors also contribute to the obesity epidemic, which is increasing at an alarming rate nationwide. By increasing the number of farmers markets and grocery stores, we could create lower obesity rates, which could alone produce productivity gains of $254 billion and avoid $60 billion in treatment expenditures per year.
There are limited resources and a lack of access to healthy, affordable foods in low-income neighborhoods. Frequently, there is a lack of full-service grocery stores and farmers markets, when available healthy food is often more expensive, whereas refined grains, added sugars, and fats are generally inexpensive and readily available in low-income neighborhoods. Low-income communities tend to be food deserts with no healthy food for many miles. When available healthy foods, especially fresh produce, is often of a poorer quality, and low-income communities have a proven greater availability of junk food stores and fast food restaurants. Therefore, increasing the availability of healthy foods in a low-income neighborhood will not only save the lives of millions of helpless Americans, but will render a much-needed decrease to the annual cost of health care.